The job of our stomach is to digest our food with acids and muscle motion, but sometimes the process doesn't work correctly and food gets stuck in our digestive system. That's called gastroparesis. And today, Dr. Jenny Wilkins from Age Vital Pharmacy is here to talk to us about how to get relief. Hi, how are you?
Great.
So I said it right, but what is
perfectly. I'm so amazed.
Gastroparesis?
Well, it's exactly how it sounds. Like the gastrointestinal gets paralyzed. So it's those muscles get paralyzed in your gut, and then the stomach has problems emptying all the food that you eat. Now, can you imagine someone suffering from this? It gets pretty chronic, and some of the patients that come in, I'm surprised how many patients actually have this, and it's induced by poor diet and inadequate nutritional supplements, and some of the symptoms can be pretty severe.
So like what are some symptoms?
A lot of patients complain, of abdominal pain. They're drinking some water and things just hurt. They eat a piece of celery and it just hurts to digest their foods. Gastrointestinal issues. See, I can't even speak today.
That's a hard one.
Yeah, feeling full too soon when you feel too bloated, and then loss of appetite. Now, some of the chronic, side effects is just projectile vomiting. And I've actually had, a patient at the Lakewood Ranch Hospital suffering from this. I'm like, call me. I'm going to come in there with an IV bag, of amino acids and nutrition.
What causes it? I mean, is it just something that happens?
Yeah, poor diet. Remember the GMOs in our food again. No one's pulling anything out of anything if it's genetically modified. So then you're not pulling out the vitamin D.
You mean, I mean, it's not like fatty, it's just
processed. Just processed garbage. And then, of course, if someone has diabetes, the more chronic conditions and ailments that you have, the more, the side effects is the gastroparesis. But now more and more, the youth is getting it because they're eating McDonald's, they're eating fast food, they're eating all this processed, hormonally tampered with milk, and then their vegetables are, genetically modified, they're seedless fruits. And it's like there's no nutritional value. They're not pulling out the calcium, the magnesium that they need. This is why, if someone is complaining or got diagnosed with gastroparesis, the first thing I tell them is, okay, let's look at your vitamin D levels.
Okay, let's talk about the products.
What can you do
my
to
CardioFit.
this?
You could do capsule injection form for somebody that has a chronic issue. It helps with the gastric emptying, so it helps strengthen those muscles. The CalMag powder actually helps with, strengthen, it causes those contractions. It's called peristalsis, so peristaltic movement. People that suffer with gastroparesis are not having those crampings in their gut to empty out their, stomach. And then you have the digestive enzymes and the probiotics. So enzymes, a huge thing. You need those enzymes in your stomach to, break everything down in its macro and micro form. So even if it's garbage food, teach your body how to break it down.
Process it through.
Yeah, process it through, straight through. The cheat enzymes are definitely my favorite. But for people that are suffering from this, it is a night and day, and it's just something, I would say about 15 or 16% of the population right now is suffering from gastroparesis. That's a huge.
It sounds terrible.
Yeah, well, it is terrible, and then the medications that they're putting these patients on, and sometimes they're removing their stomachs. I'm like, oh my gosh, it's so unnecessary. Give them the vitamins, give them the amino acids, give them the probiotics, the digestive enzymes that they need.
Awesome.
So,
well, thank you so much.
Thank you.
And you can find more about Jenny at her store, of course, on Main Street in Orange, or you can check out our website at agevital.com. And we'll be right back.